Okay, I'm going to go ahead and try to record what you're missing in class today, which is going to be Chapter 15, the Meeting the Physiological Needs. Be sure that you read the special boxes in TIMBY, client family teaching, gerontological considerations, pharmacological considerations, things like that that are in the TIMBY book, so be sure that you take special note of those types of things as well. All right. I'm going to go through this actually kind of quickly since I'm recording this, so you guys can read this off, obviously. The statistics, obviously the United States has a large population of undernourished and overnourished people. As we all know, one of the major issues that is worldwide today, but especially in the United States, is obesity. So more than 1/3 of adults, over 72 million people were obese between 2005 and 2006, which I'm sure that there's more up-to-date data. I just don't have it on me right now. In 2011, Kentucky was ranked 6th nationwide. There's an overwhelming number of children considered obese and unhealthy. And in fact, when I was going back to school for my master's, that was one of the things we had to do a large presentation on, a group project on how to limit or minimize obesity in children. All right. The CDC results from 2007 through 8, National Health and Nutrition Examination Survey, indicate that estimated 17% of children and adolescents ages 2 to 19 years are obese. So how is society trying to control the problems of obesity in America? Well, we have fad diets, which we all know about, the Atkins diet, the paleo diet, and I'm not saying any of them are bad, good, or indifferent. I'm just saying we have these things. Food choices are changing in the grocery stores and restaurants. We've got media, Hollywood, society promoting slender bodies. Although I did just hear on the news this morning that something about CVS pharmacies are not allowing Photoshop in their ads anymore, so that what you see is what you get. We'll see. Employers are offering fitness and wellness program discounts, and we have lots of people going through weight loss surgery. All right, so nutrition. What is nutrition? Nutrition, the definition of nutrition is the process by which the body uses food. In Maslow's hierarchy of needs, it's one of the physiological needs on the bottom tier. What do we consider the basic nutrients? We've got calories, proteins, carbohydrates, fats, vitamins, minerals, and water. So we need to be sure that we understand what all of these things are. So how do our bodies use these nutrients? Our bodies break down through a process called metabolism, in which your body converts what you eat and drink into energy. So it gives us energy for daily activities, maintenance of body cells and tissues, repair or replacement of body cells or tissues, and restores the body after an illness or injury. All right, so here's a little cartoon that I thought was funny. Let me have 20% fat, 40% carbohydrate, 40% protein, and a cup of tea. I mean, nobody orders their meal like that, obviously. But I don't know how many of you are label readers who really read their labels when they go shopping, or when they, if you notice on menus now, the menus all have a calorie count, how many calories are in each dish that they're serving in the whole dish. I personally am not one of those people. I probably should be, but I'm not. All right, your RDA is your recommended daily allowance. So you have an RDA of a recommended daily allowance of calories, proteins, carbohydrates, and fats, vitamins and minerals, and water. All right, we have standards. What are these standards based upon? They're based upon the recommended, the standard is the recommended daily allowance, and what do they base that upon? They base that upon your age, your height, your weight, periods of growth. Obviously, teens and adolescents are growing much faster. Younger children are growing quickly at certain times in their growth period, certain times in their lives. So these periods of growth, level activity, and the health status. Okay. So the next couple slides here are like a Jeopardy, so try not to look ahead. So how the energy of food is measured. And the answer would be, what are calories? All right, healthy adults require between 1,800 and 3,000 calories a day of the appropriate healthy foods. Normal caloric need is around 2,000 calories. Okay. So this is your range, is between 1,800 and 3,000. The average is 2,000 calories per day. Right, so what is? I'm the nutrient composed of amino acids and responsible for building, maintaining, and repairing tissue and cells. So this has to do with wound healing, right? Repairing tissues and cells. That has to do with wound healing. And the answer is protein. So when we have a patient that has a lot of skin breakdown or has any kind of wounds at all, one of the things we want to be sure that we've added into their diet, or that they have an adequate amount of in their diet, is protein to help with wound healing. So what are the two types of amino acids or proteins? We have essential and non-essential. There are non-essential amino acids. These are protein components that must come from food. And then we have non-essential amino acids or proteins, and these are protein components manufactured within the body. These are non-dependent upon your dietary intake. Okay? Essential proteins, sorry, I'm trying to read my notes here. You get essential proteins obviously from eating a well-balanced diet, because they're going to come from the food sources that you're eating. So therefore, the more well-balanced diet that you eat, the better balance you're going to have on receiving these essential proteins. Non-essential means that it's not dependent upon dietary intake, not that they're unnecessary for health, because they are still necessary for your health. All right, we are good sources of protein. So what are some good sources of protein? Milk, nuts, fish, poultry, eggs, legumes, grains. Okay, animal sources contain complete proteins. These are proteins that contain adequate amounts and proportions of all the essential amino acids. Plant sources contain incomplete proteins, or proteins that contain insufficient quantities of one or more non-essential amino acids. All right, I am the nutrient that provides a quick source of energy. And the answer is carbohydrates. All right, carbohydrates contain molecules of carbon, hydrogen, and oxygen. These are classified according to number of sugar units that they contain. You have monosaccharides, disaccharides, and polysaccharides, or starches. All right, we are healthy sources of carbohydrates. So now we're going to list examples of carbohydrates. Whole grain cereals, wheat, oats, barley, corn, cornmeal, fruits, and veggies. Milk is actually the only significant animal source of carbohydrates. What is the only significant animal source of carbohydrates? I gave you the answer. I didn't put an answer slide in there. Sorry. So, the only significant animal source of carbohydrate is milk. I am the nutrient that is a concentrated source of energy, but with twice the calories. However, I am needed for absorption of some important vitamins. The answer to this is fats. Okay, we have to have fats in our diet. So here's a cute little cartoon. Today I ate 2 bowls of dog food, a sandwich crust, some spaghetti that fell on the floor, half of your cat food, a wet tea bag, 3 bugs, and the inside of a sneaker. How many grams of fat is that? All right. We are the 3 types of fats found in foods. So again, hopefully you haven't read ahead and you understand these concepts. And the 3 types of fats that we have, that we hear about all the time, are saturated, unsaturated, and trans fats. All right, so our saturated fats, these are solid fats found in meat and animal sources, including dairy products. Saturated fats are lipids that contain as much hydrogen as their molecular structure can hold and are generally very solid. So saturated fats raises the level of cholesterol in the blood by increasing the total and the LDL, that's your bad cholesterol, therefore increasing the risk of heart disease and stroke. Examples, make sure I didn't put a new slide. No. All right, examples would be things like red meat, full-fat dairy products, palm and coconut oils. Okay, so these are saturated fats. Then you have unsaturated fats. These are fats this is a healthier form of fats. These are fats that are liquid at room temperature, found in plant sources. They lower the risk of heart disease by reducing the total cholesterol and the LDL cholesterol in the blood. And we have two types of unsaturated fats, and these are your monounsaturated and your polyunsaturated, which is what you hear about often. Some examples are things like fish, poultry, nuts, most plant oils. Right, so be sure that you read over the slide, examples, types of healthy fats. All right, then we have trans fats. These are created in an industrial process that adds hydrogen to liquid vegetable oils to make them more solid. Unsaturated liquid fats have been changed to saturated or solid fats, so they remain solid in room temperature. Another name for trans fats is partially hydrogenated oils, and you'll see that listed frequently on ingredient packages. These increases the risk of developing heart disease, stroke, and developing type 2 diabetes. So common food sources of harmful fats are saturated fat, trans fat, and dietary cholesterol. Be sure you've read over these lists and understand them. All right, cholesterol absorbs fatty acids and binds them to molecules of protein. This creates something called lipoproteins, which is a combination of fats and proteins. Normal total cholesterol should be less than 200 milligrams per deciliter. Okay, so I'm not sure how many of you have ever had your cholesterol checked, but if you have, whatever your number is, your normal total cholesterol should be less than 200 milligrams per deciliter. So cholesterol is produced in the liver, and we consume it from meat and dairy products. And I do hear people talk about their cholesterol number all the time. I thought this was funny, this big number up here. It says this number has nothing to do with the lottery or the stock market. That's your cholesterol level. That patient's in trouble. All right, two types of cholesterol, your HDL and your LDL, right? The more protein a molecule contains, the higher its density. HDLs are happy proteins, high density lipoproteins. They have more protein in them, high density, has more protein. These are happy proteins. These are happy lipoproteins. These are your good cholesterol. So these lipoproteins contain more cholesterol to be delivered to the liver for removal. Normal levels are greater than or equal to 60 milligrams per deciliter. And I'm pretty sure that page number is correct because I just recently changed this, so that should be page 291 in your book. Optimal would be 40 to 59. Would be your acceptable range for that for your HDL. Then you have your LDL, which is your low density lipoprotein. Low density L's are lousy. So one way to remember, H's are happy, L's are lousy, HDLs are happy, LDLs are lousy. That's the bad cholesterol. However you need to think of it. These lipoproteins hold little cholesterol, therefore cholesterol is left to deposit on the walls of the arteries, eventually leading to cardiovascular disease. It clogs the arteries. Now, normal levels for LDL should be less than 100 milligrams per deciliter. I skipped a few. There's just an example showing you atherosclerosis, the buildup, the plaque buildup with the cholesterol. And this is showing you your good, your HDL versus your bad, your LDL. Be sure you look over these pictures, okay? If you'll notice in this picture that the HDLs, the good cholesterol, actually decrease plaque buildup on the artery walls. All right, be sure you've read this so you understand where is the cholesterol coming from. Good meat choices for a low cholesterol diet. Skinless chicken or turkey breast, pork tenderloin, poultry, fish, shellfish. These are the leanest meats available. Be sure that you check the label. They should say 96 to 98% fat-free. Okay? All right. We help regulate many chemical processes of the body, including blood clotting and conduction of nerve impulses. And these are minerals. Okay? So take note there on page 291. I maintain water and electrolyte balance. And this is, what is sodium? This is things like table salt. You find this a lot in processed meats, processed food, period. I have here on my page on 287, table 15.2, but I don't think that 287 is the correct page number. But it should be on table 15.2. What is, I maintain electrolyte balance and assisted neuromuscular activity and enzyme reactions of the body. And this is potassium. Potassium is mostly in the cells, intracellular, right? Bananas, oranges, potatoes are high in potassium. If you have too much potassium in the blood, you can have a heart attack. If you have too little potassium in the blood, it can cause weakness and decrease cardiac heart contractility, so you don't even get to pump enough blood to the body, which would be very bad, obviously. And if you have low potassium, you get this weakness that also will cause leg cramps. All right. I also assist in maintaining fluid and electrolyte balance, aid in digestion of proteins, rid of excess fat, and secretion of hormones. And the answer is chloride. You also find chloride in table salts and processed meats as well. Right, I assist with formation of teeth and bones, neuromuscular activity, blood coagulation, and cell wall permeability. Okay, probably it gave it away right there when it said teeth and bones. The answer is calcium, milk and milk products, okay? Calcium is essential for the formation and maintenance of bones and teeth, blood clotting, normal heartbeat, and hormone secretion. All right, I regulate body metabolism and assist with promoting normal growth, and this would be iodine. All right, you find this in seafood and iodized salt. All right, I am a component of the hemoglobin and assist with cellular oxidation, and this is iron. If you have enough iron, you have strength and energy, you feel good, you're not tired all the time. When you have low iron levels, you have a lack of energy. So oftentimes when patients go in and they complain of being lethargic and tired and fatigued and they don't really know exactly what's wrong, one of the fastest and easiest things to check is a patient's iron level. So normally for an adult it should be hold on. Oh, okay, yes. So normally for an adult, 60 to 170 milligrams per deciliter. Women usually have lower iron levels. Foods that are going to be high in iron would be foods like liver, egg yolks, meat. Vitamin C helps iron and folic acid absorption. So if you have to take iron supplements or folic acid supplements, taking that with vitamin C will help absorb the iron and folic acid. Okay, so that's important. I assist with neuromuscular activity, activation of enzymes of the body, and formation of the teeth and bones. So we have teeth and bones in here again, but we've already done calcium. This is magnesium. These are whole grains, milk, meats. I'm not going to tell you that because that'll confuse you. Okay. I am the constituent of enzymes and insulin. I also assist in the synthesis of protein and play an important role in the immune system. And the answer to that is zinc. Only 20% of zinc is actually absorbed by the body. It's more important that men have zinc than women. It is a key mineral in sexual function and a protector against prostate cancer. If men have a low sperm count, maybe they're trying to get pregnant and they're doing fertility testing and they discover that the man has a low sperm count, it can actually be linked to low zinc levels. Okay, and you'll find that in seafood, liver, legumes up here, things like that. All right. You guys can read this on your own, obviously, but I just want you to see the difference. If you'll notice the key down here, pink is potassium, yellow is sodium, and these is your unprocessed products and your processed products. And just notice the difference here in the potassium and sodium. Lots more sodium down here on the bottom than up here on the top. All right, we are the chemical substances that are necessary for normal growth, health, and functioning of the human body. And the answer to that is vitamins. And here's a page, table 15.3, page 292 and 293. Be sure you look over it. You have two types of vitamins, water-soluble and fat-soluble. Water-soluble are eliminated with body fluids. They require daily replacement. B complex and vitamin C, two water-soluble vitamins. Then we have fat-soluble vitamins are stored in the body for future needs, and these are things like vitamins A, D, E, and K. All right, we are the only vitamins the body manufactures itself. So there are 3: vitamin D, vitamin K, and biotin. All right. So what happens with vitamin D is actually the sun's energy transforms the chemical in the skin into vitamin D3. Vitamin K is stored in the body fat and liver. It helps blood clotting, and it's important for bone strength. And biotin is a B vitamin. It's found in the small intestine. It's necessary for the formation of fatty acids and glucose and maintaining and metabolism of carbohydrates and amino acids. Okay. I don't remember if I said this, but be sure. Let's see. Oh yeah, I did on the other page. Table 15.3. All right. This is just giving you a food guide, history of the USDA's food guidance. So this is 1916, and then we went to this in the 50s and 60s. Oh wait, I skipped the 40s. No, in the 1916, I don't even know what food for young children. I don't know. This was 1940s. This was 50s and 60s, 70s, 90s, 2005, sorry, first, and now we're up here to 2011. Now we have the food plate. I still remember the food pyramid. I have to remember that now it's called the food plate. So here's your what's on my plate, choosemyplate.gov, your fruits, veggies, protein, grains, and dairy. Right? 30% grains, half of which are whole grains. 30% grains, 30% veggies, 20% fruits, 20% proteins. Okay? All right, moderation. Limit your intake of saturated and trans fat and choose products low in these fats. Make choices in meat, poultry, dry beans, and milk products that are low, lean, or fat-free. Choose and prepare foods and beverages with little added sugars or calorie sweeteners, which is sometimes harder for people to do. How many of you exercise at least 30 minutes a day, 5 days a week? I do not. So I applaud any of you that do. All right, you need to engage in regular physical activity and reduce sedentary activities to promote health, physiological well-being, and a healthy body weight. So physical activity should be a part of your everyday healthy living. All right, key food group messages. Focus on fruits, vary your veggies, get your calcium-rich foods, make half of your grains whole grains, go lean with protein, and know the limits on fat, salts, and sugars. So be sure you read through this, okay? It's really good information. Now, normally in class, we would do this in class. We would do an activity where you do a menu plan and do a diet record, and we would go to this myplate.gov. Obviously, we can't be doing that since I'm recording this lecture. If you want to do that on your own, I highly recommend it. It will really help you get better acclimated with these things that we've all just talked about. So, one thing though is how do you read nutrition labels? And what is included on a nutrition label. So that was one of the questions I asked you in the very beginning, is how many of you actually go to the grocery store and read through the nutrition labels? I see more and more people doing it. I do it a little bit now, but I do it because I have one child that's gluten-free now. So actually he's not gluten-free. It's a whole lot easier to look for gluten, but what I'm really looking for is wheat. So I have to look through and make sure there's no wheat in the products. But that's the only thing I actually look for on a food label. But anyway. You need to know how to read a food label. So, nutritional labeling at the top, you have your serving size, your servings per container, your calories, the calories from fat. In the middle, you have your nutrient information. And at the bottom, you have your percentage of your daily value based on 2,000 and 2,500 calorie diets. And then you have a footnote that provides information on important nutrients like fat, sodium, and fiber. All right, so here is a quick nutrition label. Right here, serving size is 1 cup. How many servings per container? 2. So this mac and cheese makes 2 cups. Check the calories. This is your quick guide to your percentage of the daily value. 5% or less is low. 20% or more is high. Limit these nutrients in yellow and get enough of these nutrients in blue. And then you have your footnote at the bottom. Okay, so this was a class activity we were going to do, which we're not doing, but if you want to take some time, look through a label, I would very much encourage that. and there's nobody to check you and say if it's right or wrong, and I didn't really check. I mean, I had some labels here that I can post on Blackboard if anybody wants those, but just go to your pantry, pick something out of the pantry, and actually go through and list these things that I'm asking you on this slide, just so that you understand what you're looking for. You should be able to find all of this information on your food label. So go to the pantry, pull out a box of mac and cheese, pull out anything that's in your pantry, and look on the box and come up with these answers to this. It's a very good exercise. Wouldn't take 5-10 minutes at the most. All right, nutritional patterns and practices. What influences our eating habits and food preferences? Culture is very significant. Income level, I think that's a huge one also. I always say I understand why people eat unhealthy because it's very expensive to eat healthy. Although the research says that that's not necessarily true. When I'm feeding a family of 5, I'm finding that to be true. It's a whole lot cheaper to run through McDonald's than it is to sit down and eat at a nicer restaurant where you get better quality food. Food preferences that are acquired as a child, meal patterns, attitude towards nutrition and exercise. If you, as the parent or as the primary provider of the meals and such, are not that concerned with nutrition and exercise and staying healthy, then nobody else is going to be either. Fortunately, in my family, my husband is very athletic and does pay attention to those types of things, and so our kids have kind of gotten that from him, which is really good. The use of food for celebrations, comfort, reward, that's something that weighs on my mind constantly. My kids are grown, and I still think about this all the time. If I'm going to reward them with something, if I give them food, am I going to damage them because I'm giving them food to reward them? There has to be a happy balance. I mean, just because you give them Tootsie Rolls to potty train or whatever doesn't mean that that is the only thing that they're only seeing, that they're getting food as a reward for everything. So there just has to be a happy balance. Your knowledge of nutrition, your time available to prepare meals is huge. Pre-prepped meals usually are not the healthiest, but they're very quick and convenient. The number of people living in the household, and your access to food, water, and grocery stores. I mean, we don't all have, run up to Kroger's 2 minutes down the road. We don't always have, not everyone has that access. All right. What is our restrict consumption of animal food sources and products? And the answer would be a vegetarian. And then we have, what is the vegetarian? That relies on plant resources or plant sources for proteins. And these are vegans. And then we've got nutritional assessment data. Why do we ask clients about their nutritional and diet history? We need to learn about their eating habits. What kind of diet they consume. What factors influence their eating patterns. Even if they're seeing us not for a medical reason, not for a dietary reason, we still need to be asking these questions. Do you have a dietary preference on what you're going to eat? Number one, we want them to eat. We may offer them foods that they're not going to eat. So we can also do some education while they're there, even if they're not there for dietary reasons. We can do some education on how to best modify their diet from the things that they like to eat and still keeping it healthy. All right, nutritional assessment. A diet history includes level of appetite, weight loss or weight gain, number of meals eaten per day, food eaten in 24 hours, time the meals are eaten, the food likes and dislikes, allergies and tolerances, and cultural influences and beliefs. So something I just wanted to point out is there is a difference between a food allergy and a food intolerance. So a lot of people tell you that they have allergies to foods and medications, but really what they have is an intolerance. So you should always ask, what type of reaction do you have? Okay, so again, one of the things you want to always ask is, what kind of reaction do you have? Food allergies, when you have an allergy, the symptoms appear very soon after you've eaten the food that has affected you. And a food intolerance, your symptoms will begin later. So food intolerance symptoms would be things like gas, abdominal pain, diarrhea. Food allergy symptoms would be things like skin hives or a rash. You may still have diarrhea, vomiting. You may have shortness of air, respiratory difficulties. an allergen is an immune response related to a protein, while an intolerance is an enzyme deficiency. Therefore, the food is not digested properly. So, you know, just a little tidbit of information that's really good to know regarding the difference between an allergy and food allergies and food intolerances. All right, nutritional assessment still, we need to find out how much alcohol use how much alcohol they use, how frequently, what's the amount. A lot of people who drink a lot don't eat a lot because they drink a lot, which they're obviously not going to get a very well-balanced diet that way. Vitamin, mineral, herbal supplements that they may be taking, problems with eating, digestion, elimination, if they're on special diets, use of antacids or laxatives. This sometimes restricts the absorption of some vitamins and minerals. If they have food restrictions, if they desire to improve their nutritional intake, if they desire to gain or lose weight. Objective data, physical assessment data, lab data, and anthropometric data. So this is stuff that you've gone over in lab. If you don't remember it, be sure you look it up from your lab paperwork and information, or look it up in your book. All right, what is? I'm the measurement of body size and composition. That's anthropometric data. So what is included in anthropometric data? Height, measured with your shoes off. Heights and weights are actually now trying to go all metric, so you're in kilos, kilograms, and centimeters. But your weight is measured with your shoes off. You get an actual, not a stated weight. Some people say, oh, I don't want to get on the scale. I just tell you I weigh blah, blah, blah. A BMI, a body mass index, calculated by using your height and weight, so it's chart specific. And you can do a mid-arm circumference, which is the amount of skin fold thickness, measures the amount of sub-Q fat deposits, and has a picture here in the book showing you how that works. All right, what physical assessment data would the nurse gather to assess the nutritional status of a client? General appearance, integrity of the mouth, condition of the teeth. I mean, if they don't have any teeth, their diet's obviously going to be very different. Their ability to chew and swallow, if they cannot chew or if they cannot swallow well. Do they have a gag reflex? The characteristics of their skin and hair. Do they appear to be healthy? Joint flexibility, hand strength, attention, and concentration. These are all things that sometimes you don't think about with the physical, with the nutrition assessment, but they need to be verified. What laboratory data is used in the assessment of nutritional status? These are things, your CBC, iron, hemoglobin, hematocrit, your immune status, check your lymphocytes, protein status, checking the serum albumin, transferrin levels, cholesterol, triglycerides, lipoproteins, your HDLs and LDLs, total cholesterol. It allows clients to know if adjustments need to be made in the amount of fats consumed. Right? We can also do a basic metabolic panel, or a CMP, which is a complete metabolic panel. Check serum electrolytes, sodium, chloride, potassium, calcium, magnesium, phosphorus. All right, management of problems interfering with nutrition. So what kind of nutritional problems may a nurse identify during the nutritional assessment? With obesity, we may find the BMI to be greater than or equal to 30 kilograms per meter squared, or out of the range for height and weight. We can do a triceps skin fold measurement that exceeds 15 millimeters. For obesity, we have emaciation, we have progressive or prolonged weight loss, consistent with malnutrition. You would have a BMI less than 16 and would equal some serious physical consequences. All right, we've got anorexia. Simple anorexia is usually short-lived symptoms requiring no medical intervention. And then we have anorexia nervosa, which is a psychological disorder, which is what most people think of when they think of anorexia, associated with 20 to 25% loss in previously stable body weight. So anorexia has a loss of appetite associated with illness, altered taste and or smell, oral problems, tension, and depression. Stomach gas, the result of swallowing a lot of air. It becomes a problem when it accumulates, causes a lot of pain. Had a lot of patients post C-section. My patients are pregnant patients usually. Post C-section, and where they've done that abdominal surgery, they will obviously air gets in there, and patients will come out complaining of tons of pain. They're hurting really bad. Some up in their shoulders, feels like they're going to have a heart attack, and actually what it is gas buildup. Nausea precedes vomiting and may be associated with feeling faint or weak. Right, vomiting or emesis, or vomiting is the act of the loss of stomach contents through the mouth. That's the act of. Emesis is actually the contents that are vomited. Excuse me. 3 types. You have retching, regurgitation, and projectile vomiting. Did y'all know that you had 3 types of vomiting? But you do, and there is a difference. So retching is when you are vomiting without emesis, so nothing comes up, kind of dry heaving. Regurgitation is when you bring stomach contents up to the mouth without the effort of vomiting. And projectile vomiting is when you're vomiting with great force, like I see this often in young children or babies, and they vomit, like projectile vomiting, like across the room, hits the wall on the other side. It's very forceful. All right, remember, if a problem exists beyond a nurse's scope of independent practice, consult the physician. Otherwise, the nurse can notify the dietitian and continue to monitor the client to evaluate the effectiveness of the nursing plan of care. So be sure to read and be familiar with the nursing guidelines for each of the nutritional problems that we discussed on the previous pages. Let's see, we got to keep going. Oh, wait, that's in pediatric. That's why it's not in here. I was like, I know there's 2 other things I want to talk about, but it's not in this one. It's in another lecture that we'll do. Okay, so be sure you pay attention to what we've already done. All right, common hospital diets. Page 303, I believe that is correct. We have regular diet, which is an unrestricted diet. Anything, they can eat anything. A light diet, which omits fried, fatty, gas-forming foods, raw foods, and rich foods. We have a soft diet, which contains food soft in texture, low residue, easily digestible, contains few or no spices or condiments, provides fewer fruits, vegetables, and meats than a light diet does. All right, baked potatoes are one thing that would be considered a soft diet. Then we have a mechanical soft diet, which resembles a light but used for clients with chewing difficulties. So this provides cooked fruits and vegetables, but the meat is ground. We have a full liquid diet, which contains fruit and vegetable juices, cream or blended soups, milk, ices, ice cream, gelatin, custard, cooked cereal like oatmeal or grits. Okay, these are full liquid diet. A clear liquid diet are things like water, clear broth, clear fruit juices, plain gelatin, tea, coffee, carbonated beverages. The rule of thumb is pretty much anything you can see through. Apple juice, grape juice, cranberry juice, popsicles, but anything you can see through. All right, and we have therapeutic diets, foods prepared to meet special needs of patients. These are things like a low sodium diet, low fat diet, high fiber, low carb, high protein, diabetic, vegetarian. Remember cultural considerations and food allergies and intolerance as well. Those are all very important things to think about when you're assessing someone's dietary status and what they're going to be eating. So I want you to be sure that you understand these different diets that we've discussed: regular, light, soft, mechanical soft, full liquid, and clear liquid. You need to be sure that you can differentiate between them all. All right, what type of clients may need feeding assistance? Clients with dysphagia. If you don't know what dysphagia is, please look it up right now. These are words you're going to have to know, okay? In class, we would discuss it, but since we're not in class, you're going to have to do some of this on your own. So client with dysphagia. Clients who are visually impaired. You may try finger foods. Describe the placement on the placement on the plate related to the clock analogy. You know, peas are at 3 o'clock, meat's at 6 o'clock. The client with dementia. Be consistent with the time and place of eating. Remove wrappers to decrease their confusion. Clients with weakness and paralysis. Be sure that you use appropriate utensils. Place things on the stronger side of the body. Okay? Timmy, page 303 through 306 has some more information on feeding assistance. All right. I think that's going to be the end of this. Remember to eat healthy. And there's still a little bit more information that Miss Baker will go over on Tuesday.